Hello, Steve Lockhart with you again today. Now I'm hoping to clear up some of the misinformation that's being given out there and help you get a better job at looking after your pain or self-treating your pain to get relief. So this video I'm going to continue on the sciatica theme, and I want to talk about massage for sciatica. So the next statement I'm going to make will probably surprise some of you if you know me and what I do, because I've spent a lifetime treating various pains in the body, especially sciatica and back pain, and one of the main modalities I use for that is massage. So my statement that massage is not a good treatment for sciatica will probably surprise a lot of you. But to clarify it, my massage, or the massage that I use it to change the body. And I find that hands-on body work is by far the best way and the fastest way of making a change to a person's posture. And it's very different from becoming a licensed massage therapist and just massaging the body. Most of the courses that you'll do in that massage therapy license is about various ways of rubbing muscles and trying to loosen up a tight area. It's a very bitsy therapy, and by that I mean it works on bits of the body. You'll see when you look at a lot of the videos on YouTube about massage for sciatica that they drape the body and they isolate that area around the hip and the lower back, and that's the bit of the body that they pretty well suggest you treat to give you some relief. But the reality is that the body is one complete system, and if you work on a bit of it or a part of it, you're really throwing that part out compared to what's going on in the rest of the body. I always advocate that any body work you do is done as a full body process, because you are trying to achieve a change in the posture of the body, or the way the body carries the load of your weight plus the weight of gravity. So obviously if you are only working on a part of the body, then you're only changing that one little area, and anything going on in the rest of the body is going to influence that to a point of really nullifying anything you've done. So somebody that wants to massage the body to treat sciatica and just work on that isolated area, you are really exposing it to any pressure or problem that is coming from somewhere else. And in most pain cases, the problem does come from somewhere else. So it's very important to understand what you are trying to do when you do massage or body work on the body, and not just rub the muscles for the sake of trying to create flexibility or movement or mobility. If you are treating sciatica, the key is to get pressure off the disc or the nerve that's being impinged, bulged, herniated, pressured in some way in that lower back. And so to get pressure off that, you need to, as I've said, change the way the body carries the weight and how it dumps in a crooked position on that area. Because if you're carrying the weight of your body and gravity in a crooked way, then obviously you're going to distort the alignment of the spinal segments, and you're going to change the position of the pelvis so that you have a conflict in that lower back area where the sciatica comes from. Now if you see a video that's talking about doing all your focus on that area where the disc and the nerve is, you run the risk of irritating the problem. Very high risk actually. And if you've ever had treatment like that, and walked away and found that it was worse the next day and it took a couple of days just to settle back to where it was, that's exactly what's happened. Because when there is pressure going into an area the wrong way, such as the posture loading into that lower back the wrong way, the body has an inbuilt ability to recognize that, and it will build up tension and tightness as a protective mechanism to try and stop too much movement of that spinal segments too much or malalignment of the spine, and to stop the pelvis going too far out of position. And in doing that, everything becomes very tight and bound up. Now, when a massage therapist goes to work on it, that's what they feel. They feel all that tension and they think, oh, I've got to get that out to make a person's sciatica feel better. But all you're doing is taking away the protection that's been laid in by the body. Now, if you take away the protection, then the problem can attack the area even worse. I find that with most sciatica cases I treat, working on that area around the disc and nerves where the bulge is or where the nerve is being impinged or under pressure, that's the last thing that I need to do. The first thing and the second thing is work on all the other areas to get the posture correct and improve the overall alignment and suppleness of the body. But to do that, we need a perfectly straight, balanced structure. So if you are out there and you're searching for information on how to fix your sciatica, and you look and you come across someone massaging and you think, oh, that would feel so good to get that, all that tightness and tension relieved from that area, just be very careful, because you could end up irritating it quite badly and being in a lot more pain than you're in. Now, sciatica comes in all different, types, if you like, or shapes and forms. We have different ways that the disc can bulge in the back, different ways that the pressure can be inflicted on the nerve, and different postures and positions the pelvis can get into to set these up. So every case is different in some way, or can be different in some way. So it's important that before you launch in and you go and get treatment for your sciatica, you get a bit of an idea of what exactly is going on in your body and where it might be coming from. I give away a free book that helps you work that out, and the idea is that you work through that, you look at your body, you check yourself out in the mirror, you have a look at your posture, you sort of go through the checklist of the different things that can contribute to a body getting into trouble, and decide for yourself where you sort of fit into the big picture. Now, if you can do that, then you're in a much better position to decide where you're going to go to get relief. Now, a lot of people tend to run off to a doctor when they get sciatica problem, and the doctor has a very limited scope when it comes to what they consider is going to help. Generally, they'll put you on drugs because they'll want you to see if you can get some rest, just some pain relief, and if that helps the problem settle away. After rest and pain relief, if that's not working, they might send you to a physiotherapist. And the risk or the problem I have with that is they tend to work on bits of the body. They tend to be very focused on parts, and they tend to advocate lots of exercises and stretches to try and relieve the problem. But again, they are focusing very much on where the nerve and the disc is a problem, rather than looking at that overall body posture and position and seeing why that area has suddenly become a problem. You might get a scan that'll show up some sort of degeneration, some sort of structural problem. The questions you've got to ask is, was that structural problem likely to have been there before the sciatica came along? Because tests or studies have shown that a lot of people have structural defects and problems in their body, yet no incidence of sciatica or back pain. So just because you see something on a scan doesn't mean automatically that that's the reason you're in pain. So there's lots of things for you to consider. But sticking with today's theme of massage with sciatica, I would tend to steer away from it as a solution, and I would tend to only consider it if the therapist is talking along the lines of using the massage and bodywork techniques to try and address the whole posture and alignment of your body's muscle system and skeleton. Because if they're talking along those lines, then they more likely understand that pressure builds up in that area because of this overall condition. And anything they can do on the rest of the body to stop something pulling or distorting the pelvis's position, to causing the spine to curve or fall the wrong way onto a disc and nerve, then that will give you some relief. But you need to ask the questions, and you need to be sure that they have a good idea of that overall body position and structure to give you the results that you probably need. A lot of people run into problems when they go and get therapy for their sciatica because they go in blindly, trusting that the therapist knows what they're doing and will give them the result that they tell them they will. But in actual fact, the person who has the problem needs to really sit back and think hard about what they need and what the therapist is telling them. Not every therapist fixes sciatica, as you would well know. In fact, probably a very small percentage of them are able to do it. So the chances of you just going into someone off the cuff, or somebody who's local, or somebody that someone's recommended, and getting that 1 or 2% of people that are switched onto it and can really make a difference for you, the chances of that are pretty slim. So keep that in mind and do your homework before you go out and get your sciatica treated, because the wrong treatment is a lot worse than no treatment at all. So good luck, and take advantage of my free book, and I would recommend you stay there for a moment, because I want to talk about a self-treatment tip that can help you with sciatica. And if you do this to yourself at home, it's not going to cost you any money. It's going to be a way of helping you put your pelvis in the right position. Okay, and if you can do that, it's going to take some pressure off that lower back, spine, discs, nerves area, and hopefully give you some relief. Okay, now my tip for the day, or for the video, and how to give you some relief from your sciatica. It's all about trying to correct the position of your pelvis. Now, the pelvis position can be affected by a few areas in your body, but one of the most common areas is the muscles in your leg, especially the upper leg. Because what happens is the muscles on one side, the leg on one side, contract and pull the pelvis down on one side. So when they contract and you're walking around and you're doing things as a normal person does, you create fatigue in that those muscles up the outside of the leg, the inside of the leg, and also up into that hip joint. And the muscle fatigue causes a contraction or a shortening up through that whole side. Now in doing that, it drops the pelvis on one side, which creates a tilted base for your spine to sit on. Now if you've got a tilted base for that spine, obviously there's quite a conflict there where the spine meets the pelvis. It's the L4, L5, L5S1 area. And if you look at your report, you'll probably find that a lot of the scans say that you have a bulge around L4, L5 or L5S1. So my little tip is to work on that upper leg muscles, the quadricep muscles. You'll pick up the adductor muscles on the inside leg as well. And by working on those, you will release the contraction out of that problem side and help the pelvis come back to a level position, which will then take stress off that lower back area. Now, if this doesn't on its own give you the relief that you need, it will form a very important part of a whole process. So if you're getting treatment from another area or another type of practitioner who's working on different things, even by getting some balance in the tension of leg muscles, tension in your leg muscles, and helping correct to get your pelvis in the straight neutral position, it's still going to contribute to what they're doing and help their job, help them get relief for you. So all you need to do is to get yourself some rubber like this. Okay, this is a rubber band. Now I made this just using a push bike tire in a tube. So I went to a push bike shop and I asked them if I could get some of their old tubes out of their bin, which they were more than happy for me to do. I cut the tube across, and I cut the tube along the full circumference, right around the length of it. And I opened it up to be a nice, flat, perfectly weighted piece of rubber. Now this is quite a decent length, and you can make some of this, or you can get some of this from other places. They have, you know, the rubber that you use from a physio that they'll give you to do exercises with. But you know, you want the real free, easy to get treatment at home. This is free because the bike shops just throw them out anyway. So you get a piece of this and you simply roll it up into a way that you can use or work with it, and you bind up your upper leg, okay, from high up in the leg near the hip all the way down to the knee, and you'll find that this will reach, okay, this sort of length. So you bind the leg up around the muscles as nice and firmly so that you feel like you're strangling the muscle a bit, right? And when you've got it like that, you can do it with a bent leg, and then all you have to do is lift and straighten your leg and put it down again, and then lift and straighten your leg and put it down again. So in other words, we're going to get you to exercise the upper leg muscles while they're encased in this tight rubber strapping, all right? Now what that's going to achieve is like a massage, a self-massage for the muscle. Now you go to a massage therapist and you'll pay $80, $100 to have them to massage all the leg muscles. And I don't say don't do that, because you know, they can be more thorough than this, and combined with this, that can be really a good way to go. But if you want to save some money and you're sick of spending money on this sort of treatment, trying to get some relief, try this one. And I do recommend that you try this along with the other self-treatment tips I've been giving in the other videos, such as working on your back with the two balls molded together. What else did I do? Oh, the self-massage on your leg, you can do that as well. But this way is something you can do just sitting in front of television. So you sit on the couch, you bind up your upper leg, wrap it around nice and tight so it's strangling it, tuck it in at the end, and then for about 3 minutes or so, or unless your body says, I need to take it off, that's enough, because your body will tell you if that's the case. But if you can do 3 or 4 minutes, that's good. And you just lift your leg off the floor and then straighten your lower leg out, bring it back, put it down, lift it up, and just work your leg. So you're working that muscle while it's strapped. And I say, it's like an internal massage. It'll really mulch that muscle. Now, after 3 or 4 minutes, take it off, fold it up again, and put it on the other leg, and do that leg 3 or 4 minutes. After you finish that leg, go back to the first leg, second leg, back and forth, okay? You can do 3 or 4 times on each leg. And when you finish, you might even find putting a hot pack on those muscles is a nice way to finish off. You can also do some quad stretching after that, just to try and get the length back in those muscles. Now, if you have the benefit of knowing which leg is your short leg, if you've been told you have a short leg before, don't write off the significance of that. You know, I hear so many people say, oh, the physio told me that I had a short leg, but they said everybody has a short leg and it's not important. Trust me, it's very important. And not everybody has a short leg. The people that have a short leg are the people with stiff, tight bodies that have problems. And if you can get your leg length perfectly balanced and sit your pelvis in a very neutral position, you go a long way into taking away the tension and lack of flexibility through your hips and spine. And of course, there are other things that contribute to that as well, and I do cover those in my free book. So be sure to download a copy of that. But this little trick with the rubber strapping is a real great self-treatment tip that will help change the way your leg muscles are pulling on your pelvis. Now I'll be using this in other little videos that I do to cover different ways of treating your body for different problems. So it's really handy to have one of these handy, and be sure to please hit the subscribe button on this video so that when I do post those tips, they'll come to you as well, and you'll get an update on anything I add when it comes to self-treating your pain. I do also want to cover more on sciatica, so stay tuned with that. And I hope this little video has helped you, given you a little bit of clarity, a little bit of help towards getting to that pain relief situation, because I know sciatica can be such a debilitating problem. It can destroy your work, your family life, everything. And so it's important that as soon as you get a problem, you get onto it, you take the right steps, you get the right therapy, and you self-treat as often as you can at home to help the process along. Now, good luck, and I'll speak to you on the next video. Bye for now.